3 months down the line, after the first infection case was recorded in the country, the Ministry of Health has released to the public the data on areas of infection distributions, one they have been using when putting in place stringent measures in a bid to curb the spread of the virus. Of the 47 counties, 23 counties have now registered at least one case of infection, 83.2% of the cases being from Mombasa and Nairobi counties. 79% of those who tested positive did not display any signs of infections by the time of confirmation. On the county's distribution of infections, Nairobi is leading with 470 cases, followed by Mombasa with 332, then Kajiado with 43, Mandera with 18, Kiambu with 17, Wajir with 16, Migori with 14, Kilifi with 10, Kwale 7, Kitui and Taita Taveta with 5, Nakuru, Uasin Gishu and Busia with 4 each, Machakos with 3, Garissa and Bungoma with 2 cases each, as well as Siaya with 2 cases. Of the 993 infections, those of the age group between 0 to 9 were 37, 10 to 19 being 60, those between 20 and 29 hitting 238. The age group between 30 and 39 was topping with 268 infections. Those of the age between 40 to 49 registering 172 cases, 50 to 59 years of age having 112 cases, and the elderly who have been topping in the list of infections countrywide registering 76 cases. 343 of the COVID-19 patients were females, with males appearing to be more susceptible, with 620 males amounting to 62% of the total number.
As a minimum, we will guarantee as Kenya, we will not stop any cargo trucks coming from any member states, including Tanzania. That is an arrangement that we must abide with as one of the member states of EAC. And so I just want to make sure that we keep our record straight, that we will continue to support commerce within EAC region, but of course by taking the necessary caution of making sure that everybody gets tested the same way we subject our own people to those kind of tests.
Kenya shares a porous border with the neighboring countries, with truck drivers being identified as potential agents of distribution. Out of the 214 cases identified at the Kenya-Tanzania border, 182 are foreigners. At the Isibania border, 10 Kenyan cases have been recorded, with 4 being from Tanzania. At the Lunga, 3 from Kenya, 24 from Tanzania. Loitoktok, 1 from Kenya, 5 from Tanzania. At Namanga border point, 16 from Kenya and 126 from Tanzania. At Taveta border point, 2 are Kenyans and 23 are Tanzanian citizens. In Nairobi County, the distribution is as follows. Kamukunji has 104 cases, Dagoretti has 56, Embakasi has 38, Langata records 34, Kibra recorded 24 cases, while Westlands recorded 22, Starehe 14 and Makadara with 13 cases. In Mombasa County, Mvita is leading with 186 cases, Likoni with 44 cases, Kisauni with 37, Nyali registering 28, Changamwe 21 and Jomvu 13 cases. Of the deaths attributed to COVID-19, 30% are household deaths. Bomet and Kiambu counties registering 1 death each, Mombasa leading with 27 cases, Nairobi following closely with 20 cases and Siaya registering 1 case. David Kagina, Switch TV.